This is a case of 30-year-old female. She is from Tarai region of Nepal, and initially she presented with complaint of fever for 2.5 months. And she also had multiple cutaneous abscesses that has been drained. One you can see on the right foot. In addition to that, she had abscesses on the right axilla, which has also been drained. In addition to cutaneous abscess, she also had septic arthritis. You can see that has been drained from the left elbow joint by orthopedician team, and she also had bluish discoloration on the right cheek. On examination of cranial nerves, we found that there is weakness of the orbicularis oculi muscles, suggestive of facial nerve palsy on the right side, which is a lower motor neuron type. Here you can see the deviation of mouth towards left side while speaking, suggestive of weakness of the right sided facial muscles. I asked her to clench her teeth and try to palpate masseter, which is equally prominent bilaterally, suggestive of intractness of the cranial nerve, and the sensorium was also sensory division was also intact, but there was involvement of the facial nerve only on the right side. And I'm asking her to look upwards. You can see that there is no wrinkling on the right side, suggestive of that the cranial seventh nerve is of lower motor neuron type. And you can see the weakness of the tongue as well, deviation towards right side, suggestive of hypoglossal nerve palsy, lower motor neuron type in the right side. In this case, what we saw that skin is involved, multiple cutaneous abscess, septic arthritis, and a skull base is also involved. We did CT scan and there was features of mastoiditis as well. So this is not only limited to periphery but central nervous system is also involved. So we sent the post for analysis of tuberculosis. Gene export for tuberculosis was negative. AFB stain was negative. So after ruling out tuberculosis in our part of the world, we started our management in line of melidiosis, because this is rainy season, and in this season from the wet soils there is high chance of contracting melodiosis. With the contaminated water, ingestion is also one of the potential route for transmission of melodiosis, and inhalation is also another route of transmission. So we started our treatment with meropenem. Generally for melodiosis we initially start with ceftazidime or carbapenem group of antibiotics, and since there was multiple cutaneous abscesses, septic arthritis as well, we started also added Cotrimoxazole, because Cotrimoxazole has good tissue penetration in those tissues. So as CNS may be involved, so we started her treatment with meropenem and 2 gram IV 8 hourly. If CNS is not involved, generally we give 1 gram IV 8 hourly. But in case of CNS involvement, we give 2 gram IV 8 hourly. And Cotrimoxazole also added in view of involvement of the musculoskeletal system and also cranial nerve, 7th nerve and 12th nerve palsy. So for treatment there are two phases. One is intensive phase and another is eradication phase. So intensive phase lasts from 2 weeks to 8 weeks. So depending upon the organ involvement, let's suppose In CNS involvement, the intensive phase can go up to 8 weeks. With IV meropenem, IV ceftazidime, it can go up to 8 weeks. Okay, but if there is just only pneumonia, intensive phase can be as short as 2 weeks. And eradication phase also can last from 3 months to 6 months. In case of the just only pneumonia, you can give eradication phase with Cotrimoxazole only for 3 months. But for CNS involvement, eradication phase lasts up to 6 months. And what is the prognosis of this melodiosis? Prognosis, the mortality is less than 10% if there is not bacteremia. But if there is bacteremia, then mortality can be high. Okay. And this patient started responding to treatment with carbapenem group of antibiotic and Cotrimoxazole.